And right here where the lumbosacral joint goes into extension, we're going to contact the sacrum and drive it down in the opposite flexion here. Oh, that was loud. Okay. Hello everyone, Dr. David Kulla here with Synergy Wellness, Chiropractic and Physical Therapy. What I wanted to talk to you guys on YouTube about is her situation. She came in for back and neck pain, right?
Yes.
Okay, we're on visit number, let's see, today is visit number 5. How are you doing so far?
I'm doing better.
Okay.
Yes.
The big issue, and one thing I wanted to discuss and explain to you guys, is she has something called lower cross syndrome. And what it is it's a postural imbalance that creates back pain. And there's also upper cross syndrome. So we'll talk about lower cross syndrome for now though. But what lower cross syndrome is, and I'm gonna exaggerate her situation a little bit, it's butt out and stomach forward and down, right? So kind of like this. And then it puts your lower back into hyperextension because you end up leaning back like this, and it just causes pinched nerves in the lower back, a lot of irritation. Another common symptom would be if you're sitting for a long period of time and then you stand up and it's kind of hard for you to sort of straighten up at first. That could also be a sign of stenosis, but commonly with lower cross syndrome, people that have been sitting for a long period of time have a hard time standing upright. After a couple minutes, the back loosens up and they're able to do that. And again, sitting aggravates the problem. And another technical term, or the medical term, is this, facet syndrome. And if you zoom in here, you'll see facet syndrome right here. And you'll see this is the bottom disc in the lower back, and you'll see it's like a wedge, a cheese wedge, where it's thinner in the back here, and the nerve is being pinched in the back.
Right.
And that's again because the butt is out, where the sacrum sticks out, and it causes hyperextension of the lumbosacral joint, where the sacrum meets the lumbar right down here, and that's what's going on with you.
Right.
So we're going to show everybody how we counteract lower cross syndrome. But we're going to start giving you some stretches and exercises, because that's going to be most important for you to get through this, but not only just to get through the pain, but to fix this problem for good, okay? So go ahead and lay on your stomach, chin at the bottom of the paper there. So this table right here has an auto flexion distraction feature. So I'll start her out on a little bit of auto flexion distraction, because she's already we've already tested her. She's already been on the table and had auto flexion distraction before. And I'll show you how that works here. So okay, strap you in here. And this technique, flexion distraction technique, is really great for anybody not only with disc herniations or stenosis, spondylolisthesis, but lower cross syndrome too, because it takes that lumbosacral joint out of hyperextension and flexes it and opens up that space right here where the wedge is here in the back and the pinched nerve. So we're going to start you on auto flexion here. You ready?
Yes.
Okay. And we're going to start doing some heat as well. You can see how the table here comes down, and we've got her back, her spine braced here with this belt. It's not as good as doing it by hand, but we're going to just loosen up the back with the auto flexion for 10 minutes, and then I'm going to come back in and I'm going to manually do the technique and adjust her. Want to heat on your upper back too?
Yes, please.
last thing. Tell me what you think in comments below. I went to film school before I got my doctorate. I do all the writing, directing, producing, sound, editing, and the cool special effects you see here. Folks, I'm not asking for an Academy Award or an Oscar, just a simple thumbs up if you like my video. And don't forget to subscribe to my channel for the latest, greatest content on YouTube. Thank you, appreciate all of you.
Okay, we're now finishing at 10 minutes of flexion distraction technique, auto flexion distraction. Now we're gonna fix that facet syndrome. I did another video on lower cross syndrome and exercises for lower cross syndrome. If any of you have any questions, comments, or want those exercises sent to your email inbox, be sure to comment below. And if you leave your email or you private message us, we can send you the list of exercises for lower cross syndrome. So you were saying to me before while you were on the machine that the symptoms I was describing before, how after sitting for a long period of time, whether it's in the car or at home or on the couch, it's difficult to get up and straighten up.
Yes.
Is that right? Were you experiencing that?
Yes. It's more like a stiffness, I would explain it as. And it takes a little while for my body to loosen up for me to get out the car. I usually experience it after a long drive.
Long drive, okay. And do you have a big car or is it more of a small compact car?
I have a crossover.
Crossover, okay.
Yes, an SUV crossover.
Okay, so it's not like a sports car where you have to climb out of it.
No, I would never survive in that type of car for that exact reason.
Yeah. And they're tight.
Yes.
Tight spaces that you have to sit in. And okay, so what we're doing right here is Cox flexion distraction technique, and you'll see I'm placing my hand on her lower thoracic spine, and we're just taking her whole lumbar spine right now and putting it in flexion just with this simple movement here. And we're going to go back down from L1 to L2 and L3. You never want to go below a disc injury. If they have a disc bulge or herniation and you place your hand below that, you could possibly set them off in a way that they're never going to get off the table. And they're never going to come back either. So, got to be really careful about that. How are we doing here?
I'm doing excellent.
No pain in the legs, right?
No.
And for you folks out there are wondering if this is painful, is it?
No, it actually feels good, like a release.
Yeah. If anything, it just feels like some tension across your lower back, and that's usually for people that are in quite a bit of acute pain. So her pelvis is not level right now, so we're going to correct that. And right here where the lumbosacral joint goes into extension, we're going to contact the sacrum and drive it down in the opposite flexion, okay? Now, I sent you some stretches and exercises, a mixture of the two. If you do those every day, this will get continually better, quickly, okay? So again, with lower cross syndrome, folks, it's a weakness of the hamstrings, the butt muscle, or the glutes, and the abdominals, your stomach. And the muscles that are too tight are the back muscles and the quads, the front of your thighs, your hip flexors in front of your thighs from too much sitting. So the stretches I sent her focus on stretching the back muscles, but the quads and hip flexors, and then strengthening the glutes or butt muscles, the hamstrings, and the abdominals. And that's what we're going to focus on with her, strengthening those 3 muscle groups to reverse this lower cross syndrome or postural imbalance that she has. Tender right there.
Yes.
And there.
Yes.
Okay, take a deep breath in and blow all the way out. Good. Okay, keep your legs straight. Raise one leg as high as you can. Good, and down. And the other one. Okay, is one leg harder to raise than the other?
Yes, they're right.
Yep. I don't know if you guys noticed that there on the video. Probably hard to see, but this leg was not raising as high. So cross this ankle over here. Yeah. And the reason for that is her sacrum was rotated counterclockwise. So we're going to take that rotation out. Okay, uncross the legs. Now try it one at a time. Wow. Okay, that went up a lot higher. Did you notice that?
Yes.
Yeah, both of them went up a lot higher. Does one feel tighter or more difficult to raise than the other?
Yes, they're right.
The right one still? Okay,
No,
cross
no.
that.
Yeah, well, yes.
Okay, cross that right ankle over the left one. Certainly better than before. Uncross them and try that one more time. Okay, and the other one? How's that?
It's good.
Yeah, I can
Much
tell they
better.
were both going up evenly. Great. Okay, and that was all because of the sacrum being rotated. People that sit with cross-legged, things like that, can have problems with rotation of the sacrum. Go ahead and turn over on your back. And cross your arms in front of you. Tuck your chin down, deep breath in. Good, and blow out. Let's see your hands up.
Up.
Mm-hmm. Okay, great. Feel that right there? Do you have any headaches in the last few days or sinus congestion?
Yes.
Both or just one? Or the other?
Sinus, yeah, both.
Both,
Mhm.
okay.
Oh.
So I just adjusted C2. C2 controls or goes to the sinuses and can also create a headache, a nice tension headache. So that should be a big relief right there for you. And relax here.
Oh.
Oh, that was loud.
Mhm.
Okay. All right, roll over to your side and come up that way and make sure you tie your shoelaces good.
Okay, which you want me to take over?
Well, roll
time?
over to your side and
Okay.
sit up from the sideline
Okay.
position. Yep. And then I just want to make sure you tie your shoelaces so you don't trip on your way out of here.
Okay.
Okay.
Yes.
All right. Do you have any questions
No,
about what I went over?
None at all.
Okay, you'll get the exercises in your inbox. Take a look at those, work through those. If you have any questions, let me know.
Okay.
And you guys, if you have any questions, let me know. Again, we did another video on lower cross syndrome. So if there's anything, any particular video you want to see or any questions you have about lower cross syndrome, just comment below. Thanks for liking the video. See you guys soon.